Total knee typically is performed for people with arthritis. The most common type of arthritis is just the wear and tear type of arthritis or degenerative joint disease. People also call it osteoarthritis. That is by far the most common reason that people will need total knee replacement. From a standpoint of symptoms, it's typically patients are having pain, patients are having difficulty with walking or ambulation. It even gets to the point where people are not even comfortable when they're not up and around on their knee. A lot of patients think of knee replacement that we just remove a large portion of the bottom of the thigh bone and the top of the shin bone, and there's a large contraption that comes in and is a knee replacement. Knee replacement really is more of a resurfacing procedure. We remove the worn out articular cartilage and bone from the distal part of the thigh bone. We remove the worn out cartilage and bone from the top of the shin bone. And then there is a metal cap, typically cobalt chrome, that goes over the distal femur. There's a resurfacing on the top part of the shin bone. And then there's a strong polyethylene or plastic spacer, which is in between, which is the bearing surface, which really is the resurfacing of the new knee.